Subtypes of autosclerosis. There are two subtypes, namely fenestral, that confines to the stapes and the oval window. That constitutes nearly 80%. The fenestral subtype. This involves the oval window and the stapes footplate. Hearing loss is often conductive due to stapes thickening and fixation. The second subtype is retrofenestral, also called cochlea, and comprises 20% of the cases. The cochlear involvement with demineralization of the cochlear capsule with hearing loss, often sensorineural, but the mechanism by which this occurs is often uncertain. The two subtypes of autosclerosis, number one, fenestral 80% stapedial, number two, the cochlear or the retrofenestral type 20%. The prefix retro does not mean posterior but rather behind, as in deep to the medial wall of the middle ear from the perspective of otoscopy. Retrofenestral autosclerosis usually occurs with fenestral involvement, so the two entities are considered a continuum rather than distinct. On imaging, two main types of presentations have been described. In fenestral, which is the most common, the site of involvement is just anterior to the oval window, involving a small cleft known as the fissula antifenestrum. Bony overgrowth can cause fixation of the stapes. In retrofenestral, which is the second most common, the involvement is of the round window niche, which when present accompanies fenestral disease. However, isolated round window autosclerosis can also be seen. The bone surrounding the cochlea is the site of involvement in the retrofenestral type, which may be focal or circumferential, in which this produces a fourth turn or a double ring sign. CT grading system of Simmons and Fanning. Various authors have used CT grading systems of autosclerosis in their studies. However, a Lee article in 2009 assured that the Simmons and Fanning CT grading system yields excellent inter-observer and intra-observer agreement. What are the grades? Grade 1 CT grading of Simmons and Fanning of autosclerosis. Grade 1 solely fenestral, either spongiotic or sclerotic, evident as a thickened stapes footplate and or decalcified, narrowed or enlarged round or oval windows. Grade 2 patchy localized cochlear disease with or without fenestral involvement, in which grade 2A the basal turn of the cochlear is involved, grade 2B middle and apical turns, and grade 2C both the basal turn and the middle apical turn involvement. And finally, there is grade 3 where there is diffuse confluent cochlear involvement of the otic capsule with or without fenestral involvement. Now, these are the various grades. Grade 0 normal, grade 1 small lucent lesion at the fissula antifenestrum, grade 2A sclerosis and narrowing of the basal turn, also has spongiotic fenestral disease, grade 2B lucent lesion extending from the fissula antifenestrum to the middle turn of the cochlea, grade 2C patchy lucency around the lateral aspect of the basal, middle and apical turns. The medial aspect of the cochlea appears spared, and grade 3 is severe confluent lucency around the cochlea. The various stages of cochlear of autosclerosis and the subtypes of autosclerosis.